Hi, this is the Dr. Tave's Diaries, and today we will be discussing health-seeking behaviors and patient autonomy. So what are patient health-seeking behaviors? This is basically how we all seek out health pertaining to our health. Yes. And so basically, first and foremost, you must think of it or approach it in a way that there are factors like your own self, internal factors that affect how you seek out help for your health, and then the external factors that also, have an impact or have an effect on how you seek out your help for your health. So first and foremost, internal beliefs. What you believe about your health. Like number one, is your health important? Is it more important than your money? Is it more important than your job? Very important question to ask. Is it more important than all the other responsibilities that you're faced with? A lot of us put our health second to our money, our work, and our families. We will literally sacrifice our bodies and we will wait until we collapse before we actually go out and look for help. Yes, there's certain things that, look, you can't get away from. For example, you need to make sure that your kids are safe. You need to make sure that there's food on the table, and so forth, which is understandable. But then there comes a point where you yourself need to say, okay, enough is enough. I actually need help. And that's when you go out and you seek for it. So for example, you can give yourself a timeline and say, look, I'm going to give myself a week. If this pain in my knee or my hip hasn't gotten better within this week, I am going to go out and find help. So you give yourself that timeline and you make a contract with yourself to say, this is what I'm going to do. All right. And then the second belief that's actually that the thing that affects us is also to, we believe that this thing's going to go away. We have this perception because we are so afraid that what if this is something like cancer or an incurable disease, a disease where there's no cure, there's no medication, there's no surgery for it. And so we tend to, run around, or we try to, avoid it, and we ignore that little growth on your skin somewhere here, or we ignore that pain, and so forth, and we ignore it and we hope, oh my goodness, I just hope it disappears. Yeah, you know what? It'll come and go. God willing, it just goes. But then the thing is that it doesn't go. And instead, this thing keeps growing and growing. And people around you are giving you all sorts of home remedies. Try this, try that. You know what? My cousin went to such and such a person next door and they helped them. And you go in circles, and yet this thing is getting worse. And by the time you come to the doctor for help, it's too late. It's too late. There's nothing we can do. Or the treatment measures are even more serious or more involved. It needs you to take more time off from work to come and sit here, and we need to treat you. And had you come 2 months ago, before you started looking for help everywhere, we could have helped you. So, we need to have those timelines where we say, if this is happening, I'm calling it quits. I'm saying enough is enough. I'm going to see the doctor. Then the other thing that actually affects us is actually gender. Men have been found to have worse health-seeking behavior. They're the worst because men feel that, you know what, I'm a man, I'm strong, I need to be this, or I've got family responsibilities, or this or that. And men try to evade or ignore problems when it comes to their body more than women do. Women are more likely to go out and find help than men. It's actually proven, guys. It's actually the truth. So as a man, first and foremost, I want to say, as men, please go and find help. Don't wait and say, you know what, I'll be tough. I won't complain about this little pain here. No. Sometimes you see a man literally coughing out blood before he comes to the hospital. He's been coughing for 2 months straight, but then he decides, because now he's coughing out blood, and everybody's just like, you know what, enough is enough. You're going to die on us here. We're taking you to the hospital. That's another thing, and also people who are older people tend to be a bit more stubborn because of their age. They know better, they know more, they've seen life, and you're like, but ma, I want to take you. Yeah, no, we'll go. And there's this, we'll go. This procrastinating business must come to an end. Health-seeking behaviors are very important. Then the other thing that actually affects the way people seek out help is facilities. If you go into a clinic and the sisters or the doctors are not as, approachable. Of course, as patients, you're going to try to avoid going there because you're like, you go there and then they start shouting at you. Not that they shout at you, they keep giving you this tube and you keep saying to yourself, you know what, there's something wrong here. I really feel it in my guts that this tube is not helping. Things are getting worse and the sister keeps giving me this tube. I want to tell you as a patient, you have every right to say to a person, you know what, no disrespect to you, I really respect your position, I respect your job, I respect your qualifications in every way. But I feel that I really need a second opinion. I need you to refer me to the district hospital if you're at the clinic, or the district hospital, I need you to refer me to a specialist because I really feel that this thing is so serious and I can't wait. And you go out and you get a second opinion. There is nothing wrong. I even tell patients as a specialist, I say, you know what, mama, if you're not comfortable with me being a treating doctor, please go out there and seek out a second opinion. Here's the name of a doctor I can even recommend, or there's this other facility or that other facility. Go there and seek help. Because I believe it. As a patient, you have the right to do so, Which then brings me to autonomy. What is autonomy? Autonomy is where you as the patient have the right to make decisions about your own body. There's no amount of qualifications, professorship, or whatever that can force you as a patient to do something that you don't feel comfortable doing with your own body. You have that right to say, you know what, I want to make decisions about my body. So first and foremost, you have the right to say, doctor, I want to find out about this condition you're telling me. You are saying that I have 1, 2, 3, whether it is migraines or endometriosis, or you've got a breast lump, or you've got, erectile dysfunction, all these things that we talk about, your child has got, eczema, whatever. And you're like, you know what, I want to know more about this condition. Please write the name down here so that I can go home and read about it. The more information you have as the patient, the better the decisions you can make about your own health. If you do not have knowledge, you cannot make informed decisions. You cannot. So it's important that whenever a doctor says something to you, you have the right to say, doctor, wait, explain that term to me. Okay? And look, yes, doctors are busy and so forth and so forth. So at least if they've given you the name, go home, buy data, research and read. Like how we used to do a school projects? Yeah, do that. And then the other thing about informed decisions is that when a doctor is going to treat you for something or give you tablets or whatever, you know what, you need to also go and read about those tablets. Find out, what are the side effects for yourself. Know them so that if you do experience them, you can say, doctor, I'm drinking this tablet, but it's making me have palpitations. It's making me uncomfortable. My heart is beating funny. I don't like this. Then you can also go back sooner rather than later because you're suffering from side effects, because all treatments have some form of side effects. Okay, all of them, whether they're small or big, they all do. And we sometimes experience those side effects, sometimes we don't. But that's what I'm saying. You need to find out for yourself. And then the last thing when it comes to autonomy, which is the most important thing, is that as a patient, before you go for any surgical procedure, the doctor has to explain to you what they are going to do. This thing of just saying, doctor knows best, the doctor knows, I'll just, let them do whatever they want. That's gone out the window. That type of thinking is gone and out. It's archaic, it's old, it's extinct. It belongs in a museum, that type of thinking. You as the patient, whenever a doctor is going to operate on you, At the end of the day, why I'm saying that you need to know what they're going to do is because you sign a form that says, I have been given I'm giving informed consent. Informed consent means that you have received information. You as the patient understand what this doctor is going to do to your body, or the sister, or whoever. You as the patient know the risks. You as the patient understand that there might be complications, and you understand as well what will happen if those complications are there. Informed consent, that is what it means. So when you sign that paper, you better make sure you understand these things. That is why your doctor must spend time with you. And if they cannot spend enough time with you explaining, you must at least say, doctor, write the procedure down so I can go and research about it. Read, what is a levator resection? When they're lifting up my eyelids, what does that mean? What does it mean when, and you go read it up. And you find out about it. And then you come back next time, you can say, doctor, I read about this. I don't understand. What are the risks of me getting my eyes going dry after lifting up my eyelids? What are the chances? These are the questions you should be asking. Because after the operation, that's not the time to be asking. After the op, it's too late, Baba. It's too late. It's done. It's done. Or when complications are happening, it's too late to be getting angry and upset. It's too late. That's not the time to be getting angry and upset and asking questions. The deed has been done. Pelile. You know what I'm saying? So you need to ask, okay, and get the full information. And if you don't want the operation, and I promise you, I have had patients who I have said, listen, this procedure is going to save your life. And the patient literally said to me, no, doctor, I don't want this procedure. And no matter what, I as the doctor, as much as I know, I cannot force that patient to do it. Even if I know that this operation will give them a 90% chance of saving their lives. If that patient says no, that is their body, and I have to respect that. It is that serious. So you have the right to say no, doctor. And also the other questions you should be asking, another question you should ask is, doctor, if I don't have this operation, what's going to happen? Am I going to die? Am I going to live? Am I going to lose my pinky? What's going to happen? If, doctor, I don't do the operation now, can I do it at a later stage? Is it still going to be the same thing or not? Is it still going to be the same thing or not? Is it still going to be the same outcome, good outcome, or is it going to be a worse outcome? And so you can make an informed decision that, okay, am I going to do this operation now, or am I going to wait until later? Am I willing to take the risk of not doing that operation? You must know that either way, whether you do the operation or not, you as the patient carry the risk because it is your body. You are the one who suffers or who gains. Either way, you are the one. And as doctors, we understand this. We understand this concept so deeply. We do. And that is why even when we're suggesting an operation, okay, there's some certain situations that are like, okay, guy, if you don't do this operation, you're going to die. Okay, like for example, if you've got an appendicitis, and it's really, really bad, and like it's close to bursting into your tummy and spreading infection all over your abdomen, and once you have like infection in your tummy, then you end up in ICU and there's very high chances of you dying. Then we'll be like, okay, look, if you don't do this operation, you're gonna die. Okay, and obviously at that point you're in pain, you're like, oh my gosh, I feel like I'm already dying. Then obviously, it's like, okay, we need to do this. And that time, you don't have the time to be explaining a lot of things because it's an emergency operation. But in the cases where it's not an emergency operation, but it's an operation where you've got time to think things through, please take the time to think things through because you have the right. Your health is in your hands, So yeah, I really invite you to leave comments below about what you think about this conversation, this talk that I've given about, health-seeking behaviors and autonomy. What do you think about it as a patient? Getting a second opinion, having the choice of which doctor you go to. Obviously, in government, you don't have a choice. The doctor in front of you is the doctor in front of you. But, what are your thoughts? I would love to find out or hear about them, because this is a very serious topic that we as doctors and patients, that relationship has to be there, I as a doctor know a lot more than you. But at the end of the day, you are the one who needs to make the decision. It's a very funny thing. It's a very, very interesting concept, I must say, But anyways, guys, let me know what you think. Leave your comments below and let's have a conversation. So until next time, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.